Liver is the metabolic center and the largest detoxification organ of human body. Fat may accumulate excessively in the liver due to various reasons. If the fat content is over 5%, it can be diagnosed as fatty liver. With the incidence of fatty liver increased during recent years, fatty liver has taken the place of viral hepatitis and becomes the #1 liver disease. In addition, the fatty liver population tends to be younger. Obesity, diabetes, and alcohol abuse are currently the 3 major causes of fatty liver, and unhealthy lifestyles are the main reason for the high incidence of fatty liver. What are the hazards of fatty liver? Researchers prove that 75% liver function abnormalities are related to fatty liver. If fatty liver is not effectively controlled, 15 to 30% of them will develop into liver fibrosis and then cirrhosis, and 20% of patients will suffer from liver cancer 5 years later. Statistics show that 48 to 100% of non-alcoholic fatty liver patients are asymptomatic. But the incidence of diabetes in non-alcoholic fatty liver patients is 3 times than the average of the entire population. Fatty liver has also been strongly associated with metabolic disorders and metabolic syndrome. And metabolic syndrome is a risk for high incidence of coronary heart disease and cerebrovascular disease. Liver biopsy is the gold standard to diagnose fatty liver. However, it's invasive and causes complications, therefore it's not the first choice. Many other non-invasive and painless methods are more preferred. 2D ultrasound has low sensitivity in qualitative judgment, which cannot detect early stage of fibrosis. MRI or CT has high sensitivity, but expensive and cannot detect early stage of liver fibrosis. The best solution is the transient elastogrsphy and ultrasound attenuation technology, which is non-invasive and painless, sensitive, quantitative, and reliable, fast and economic. It can detect early stage of liver fibrosis and fatty liver. Therefore, it's recommended in the guidelines of different societies of hapatology globally. The Hepatus Non-invasive liver diagnostic ultrasound system adopts the visual transient elastography and ultrasound attenuation technology. The patient needs to fast for 2 hours before the examination and then lie down, lift the right arm during the examination. The operator only needs to place the probe between the right intercostal space, then can easily find the appropriate position of the liver under the guidance of real-time ultrasound image. The vibration of the probe generates shear waves. By detecting the shear wave velocity and sound attenuation coefficient, the device can quantitatively assess the degree of liver fibrosis and fatty liver. The entire examination takes only 2 minutes. Results are instantly available. People with diabetes, hypertension, and obesity should be well aware of fatty liver. It's recommended that patients with fatty liver check every 3 to 6 months to evaluate whether it's recovering or worsening. Get to know fatty liver, pay attention to its hazards, detect and treat fatty liver early.